So I'm thinking we're ready to go.
Yep, our faces will show first though, when it's time. We're in the 30 seconds there. Hello.
Hello. So we're ready to start, yes?
Yes.
All right, well, good afternoon. We are so pleased to get to talk to you today about telehealth communication. First, let me introduce myself. My name is Marcy Rosenbaum. I'm a professor of family medicine. I also work for the Office of Consultation and Research in Medical Education, and I've been teaching and doing research on clinician-patient education for most of my career. And I'll let my co-host introduce herself.
Hi, I'm Kelly Skelly. I'm from the Department of Family Medicine, and I am a clinician.
So with the onset of this pandemic, we know that the use of video and phone visits has increased exponentially. And actually a recent report from Press Ganey noted that between January and the end of April, 70% of all of their surveys reflected either full video visits or mixed telehealth visits that combine video, phone, and email. Now, in this report, in their preliminary analysis of more than 30,000 responses to telehealth visits, they show that overall, that patients are actually receiving it well and that ratings are high even when there are technological issues in these telehealth visits. So that's reassuring. These reports, as well as others, though, point to opportunities for enhancing provider and patient connection by addressing some challenges and strategies for effective telehealth communication. So that's what we are going to focus on in this session, this BeLive session today. So drawing on available recommendations, what we thought we would do is just go through a telehealth visit kind of in chronological order from the beginning to the end. And what we want to do is I'll summarize certain points and strategies as we go along, and then we'll take little breaks and we'll have Kelly demonstrate how she implements these strategies in her own practice. Now, as you're going to see, many of the tips we'll talk about reinforce the communication skills you would use in any encounter, whether it's in person or over telehealth. What we want to do here, though, is really emphasize those strategies that are the most important to remember specifically for telehealth as a way to enhance those visits. We welcome any comments or questions during this. I think there's a chat function you can use, and we're going to make some time at the end to address those questions. So I think we'll go ahead and get started by talking about before you start the visit and what you can do to prepare for it. And to let you know, as I go through this, the skills I'm going to be talking about apply really both to phone and video visits, and then where there are specific things for video visits, I'll highlight those. So in terms of preparation, probably the most important thing is to make sure that the patient or family member you're talking to feels that they have your full attention. And there are several things you can do to make sure that you are giving them your full attention. Certainly just taking a breath before you start one of these calls, just like you would maybe take a breath between seeing patients in person, is a helpful thing to do, especially if you're doing several calls in a row. I actually recommend standing up in between, just stretching a little. Related to that as well, you should just make sure that you're seated comfortably because with these nonverbal things, actually, even on the phone, patients can pick up if you're not comfortably seated. You also want to make sure that you are away from noisy areas if you can be. And wearing headphones can help at least to make sure you can hear people. And then another thing is to just minimize distractions. So turn off your phone, turn off your email. And again, even on the phone, patients can pick up on whether you're distracted. Now, a couple of preparation tips specifically for video visits is just thinking about how do you appear on the screen to the people you're talking to. And a couple of tips that are helpful is one, just avoid any distracting backgrounds, either people moving around behind you, or I know there are virtual backgrounds available, but they can be distracting. So pay attention that it's not distracting. And then the other thing is just make sure that your face is properly lit so people can see it. So no backlighting. So now you're ready to roll on your telehealth visit with those. So to start the visit, just like with any other visit, you want to identify the patient you're talking to, introduce yourself and what your role is. Then really early, I think it's just useful to check in and say, is this a good time for this call? And in particular, to make sure that they feel they're in a space where they can talk frankly and hear. So you can keep confidentiality and privacy. Because it's a telehealth visit, it's also worth having kind of a technological check-in. So at the beginning, you want to first acknowledge telehealth. We call it right now the elephant in the room, even though we're not in the room, of just saying, I know that this might be different than regular visits that are going on, or talking something about that. And then also checking in that the patient can see and hear, and you can as well. And with that, it's fine to encourage them to ask you to repeat things if they don't hear them, and to ask questions in that context. So then in terms of beginning the visit, just like with any visit, you want to establish a little rapport. And I think it's even more important with telehealth visits because you're not in the same room. Now, one way to make that connection, which is relevant to everyone right now, is to just check in on how they're coping with the pandemic, because it's affecting all of us. It doesn't have to be very long, but it's just a useful acknowledgement. What I want you to keep in mind, and you'll start at the beginning of the visit, but keep throughout, has to do with your nonverbal communication. So a few things to keep in mind. One is to smile, especially at the beginning and end of a conversation, and use a warm tone of voice. Also, in terms of nonverbals, it's likely you're going to be looking at the electronic medical record and maybe writing some things in it. And you should explicitly state when you're doing that, I'm just going to look this up, or I'm just typing in the record. And the reason for that, even in phone visits, is patients can pick up whether you're smiling and your tone of voice and whether you're looking elsewhere. For video visits, the only additional nonverbal thing to consider is eye contact. So often on video visits, when you're looking, if you're looking at the patient, on the other side of the screen, it actually looks like you're looking at their mouth or something. So be aware of where the camera is on your video visit, and periodically make a point of looking at the camera, especially when you're listening. Can you see that I'm doing that? So you can make more of that connection. So I think that this is probably a really good place to stop. And let's have Kelly demonstrate what she does. I'm going to pretend to be her patient on this video visit. Oops. Sorry about that. All right.
Marcy Rosenbaum?
Yeah.
I just need you to confirm your full name and birthday.
Okay, so it's Marcy Rosenbaum, 2/28/62.
Great. I'm Dr. Skelly from the University of Iowa Family Medicine. Were you planning to do a video visit with me today?
I was.
Okay. Are you somewhere confidential where we can talk?
Yes, I am.
Can you see me?
Yeah, I think I can.
Okay. If you end up not hearing or understanding me, please feel free to ask me to repeat something or to clarify. And if we get disconnected, I'll log back in and reconnect the video, and you do that too. But if we don't reach each other, I'll call you on the phone.
Okay. I was a little worried about that. That's great.
This video doctoring is something, isn't it? How are things going for you in the pandemic?
Oh, I've been inside for weeks, really, but getting used to it, I guess.
It's different for all of us.
Yes. Okay, so there's our little demonstration of just beginning. And Kelly did a really nice job of demonstrating the things we talked about. So let's talk about as we move on. So you've set that up, you've established some rapport, and now you want to start your visit. So some of the first things you're going to do is just what we call signpost, say explicitly what you understand the purpose of the visit to be. And if it's appropriate, to say, what is the duration of the call? So how long will it last? And then the good thing to remember is to start with agenda setting. And you do this in in-person visits as well. It's this idea that you get the list of all the things that the patient would like to discuss up front before going into any depth. And you can imagine that these patients have been preparing for this call and been thinking about, oh, I want to make sure I ask the doctor about this or that. So the idea is you get that list up front, then you go into detail. And the reasons for doing this is, one, then you know everything they want to talk about. 2, it can actually help with your diagnostic reasoning because some of those things on the list may be related. And 3, there's actually really good evidence that shows if you use that upfront agenda setting, you're less likely to get what we call the hand on the doorknob, which wouldn't happen in telehealth. Oh, by the way, doctor, I'm having some clenching chest pain. So that's the reason for doing it. And I think this is probably a good place to stop and just have Kelly demonstrate that bit.
So Marcy, we have 20 minutes set aside for this visit. And to make the most of our time together, I'd like to make sure we can address all your concerns. What concerns do you want to talk about today?
Well, I've been having these headaches.
Okay, headaches. Anything else?
I've actually noticed that I've been having a bit of a scratchy throat.
Okay, headaches and scratchy throat. Anything else?
No, that's really it.
Okay, so headache and scratchy throat. Which of these are you most concerned about?
Oh, definitely the headaches is the most concern to me.
Okay, so I also wanted to talk to you about blood pressure control. So let's start with your headaches. Can you tell me about your headaches?
Sure, and I think I'll stop here because we just want to demonstrate these skills very briefly for you. All right, so then moving on, I want to emphasize a couple of the most important communication skills, particularly with telehealth. So throughout, one of the key communication skills, which won't be a surprise to you, is active listening. And I know that you do all listen to your patients. The challenge with telehealth is sometimes it's not that clear to who you're talking to that you're listening. So here are a few things that you should try to emphasize and do more to let the patient know that you're listening. So one is verbal acknowledgments. I'm sure you do this all the time. Just remember to do it more. So as someone's talking, instead of just quietly listening, do the tell me more, any of those verbal acknowledgments. Absolutely use clarification if there are parts of it you're not understanding because of the technology, and saying something like, I want to be sure I understand what you're saying. And then probably summarize what's being talked about a little more often than you might in an in-person visit so they can keep track of it. Overall, you want to speak slowly and clearly, and some recommendations are you have to speak more slowly with telehealth just because the connection can be difficult. And just like in an in-person visits, avoid jargon. So minimize medical language where you can. Now, as far as video visits, the only other thing I want to add as far as nonverbal listening is you can be more animated with your nonverbal acknowledgments. Kelly's doing a lovely demonstration right now. So paying attention to the fact that you're being more animated. Another really key communication skill to emphasize here is picking up and responding to patients' emotional cues. And as you know, all medical encounters include emotional content. Anybody who's been ill or who needs to talk to a healthcare provider, there's emotions in there. And in telehealth visits, the challenge is, one, it can be more difficult to identify the emotional response of the people that you're talking to, and also to convey your own empathy and compassion. So here are some tips related to that. One, in terms of picking up on emotional cues. So first, on the phone where you can't see the patient, be listening to their verbal statements, and also not just statements, so saying, I don't know how much more of this I can take, but hesitations or sighing or anything that might indicate an emotion. Certainly for video, what you want to do is, between looking directly at the camera, as we discussed, make sure you're looking at the patient, especially, at times when they're talking, so you can pick up on, they'll give you those nonverbal cues that you see in person. A second thing to do is explore patients' responses more explicitly. So I heard you say you can't take much more of this. Can you tell me how you're feeling about it? Or tell me how you're feeling about all of this. And then I think the most important thing is, I think we tend to rely on nonverbal empathy a lot in in-person encounters. In telehealth encounters, even video, it doesn't work that well. I mean, I do suggest leaning forward when someone's expressing emotion. What you really need to do is make explicit empathic statements where you're reflecting back what you're hearing. I know this has been a difficult time, etc. Those kinds of things. So what I'd like to do now is let's just have Kelly with her patient demonstrate this. So I guess I'm starting by telling you, you had asked me to tell you about my headaches. So I've been having these headaches for about 2 months, probably once a week. They're usually on the top of my face and they last for several hours. I mean, I've never really had anything like this before.
So this is something new for you. When you say the top of your face, what do you mean? Can you point to that area?
Yeah, I mean, it's usually like right above my right temple. It's weird. I don't know.
I heard you hesitate. How are you feeling about all this?
I mean, it's really interfering with my life. I usually have to lie down in the dark when it happens. And, I really don't have time with that, with work and family and stuff.
I'm sorry to hear you're having this pain. It sounds difficult to live in this way. Can you tell me more about it?
Sure, I'll do it in a little bit, Kelly. Really, we just want to give you some brief demos. Thank you so much, Kelly, for that. Okay, so those are really 2 important things to remember. And then we've been talking a lot so far about gathering information, the history, taking part, or just getting set up with a patient. I want to talk a little bit about some of what we do in terms of sharing information with patients and things that are helpful to emphasize. So the first thing is to make sure and orient the patients to what you're going to be talking about. And part of the reason for doing this even more so on telehealth visits is they can't see you to go through information. And so they're having to, in their mind, kind of follow your logic or follow your organization. So be explicit about your organization by saying, I'm going to tell you about 3 treatment options and the pros and cons. And then we suggest you use something called ARTA loops. And if you've done the provider communication program, you're familiar with these. And it's just this idea. ARTA stands for ask, tell, respond, ask. So essentially, when you start giving any type of information, it's useful first to find out what does the patient know. So ask about their starting points. And then depending on what they tell you, if what they know is what you agree with, then you can respond by saying that's right. If they're wrong, you can correct it. And they may express some emotional distress. So that's an opportunity to respond with empathy. Then in giving information, what we recommend, it's called chunk and check. So it's this idea that you give information in small chunks and then you pause and give the patient room to ask questions, respond. You can even elicit questions by saying, what questions do you have so far? Which is recommended much more so than, do you have any questions? It's an open one. So chunk and check. And what they say for telehealth in particular is probably the chunks of information you might use in person. Over telehealth, they need to be even shorter. So pay attention to how much information you're giving and then check for understanding. So saying things like, what questions do you have so far? So Kelly, how would you feel about us doing that part of the encounter?
Okay. So what do you understand so far about your headaches?
I've lost my script. Hold on a second. Of course this would happen.
You did a very nice job of explaining them. I'm sorry.
Okay. What do I understand so far about my headaches? Sorry about that. So what I understand about my headaches is that I'm taking Topamax to stop having these migraines, but it might not be as good as I want it to be because I keep having them. But they're not as bad.
Right. Okay. So the goal is to have less than a headache a week. And if it's more than that, send me a MyChart note so we can change the dose and decide what to do next. You can keep a symptom diary about when you get headaches, and we can see what happens with a higher dose of Topamax if you take 2 pills every morning. So to make sure that you understand and that we both have the same plan, what will you be doing next?
Okay, so I'm going to take 2 of the, is it Topamax every morning, and then I'm going to keep a diary of my symptoms and let you know if I'm having more than 1 a week.
Sure. You'll just record when you have the headaches, and the situation where you have the headaches, and share that diary with me after increasing the Topamax so we can see if it decreases the frequency.
That sounds good.
Good.
Okay. So what we've done here, I know it's been a whirlwind tour of just some of the main tips about telehealth, and there's certainly other things that we could talk to you about, and we'd be pleased to talk to you about, especially if people have any questions. What I'd like to do is just summarize the tips that we've gone over, and I think this is a useful place for me to point out that we have put together a telehealth tip sheet that summarizes all of these skills plus additional ones, in particular, how you fit it in with some of your documentation. And that will be available on the loop after this broadcast to look at. If you found this helpful as well, we've been doing these kinds of talks in different people's departments for grand rounds, et cetera. So we're willing to do that. But let me just summarize what are the main points. And I actually think the Press-Ganey report that I referred to at the beginning does a really nice summary of the main things that you should be paying attention to. And they identify 4 things. One, they call it what they call authenticity, which is the idea of being genuine, helping the person on the other end of the call know that they have your full attention, being conscious of the warmth of your opening and closing greetings, and also just making sure that you can communicate fully by being able to hear each other without any interruption. So one is authenticity. Second is that idea about agenda setting in terms of identifying what does the patient want to talk about and what are their priorities, and assuring them that these priorities will be addressed if it fits into that call. Then listening and empathy. So really conveying your caring and compassion very explicitly, trying to pick up on those cues, saying something about it, and conveying that you're listening. It is even more important over telehealth because you might be talking to someone who hasn't seen anybody in person for quite a while. And so being able to connect with you and feel supported is so important. And then having a way to close the session so everyone leaves being on the same page and the patient knows what to expect and can tell you what their understanding is about what to expect and then how to contact you later. So those are really the main points that we wanted to make today. And now we are open to...
Before we do that, do you want to demonstrate how we close the visit?
Did we not do that? I thought we did.
A little bit.
Silly.
I think it's really important to, as Marcy mentioned, to orient the patient to the phone call or the televisit is over, because sometimes it could go on. And so if we're real specific and we orient them and use teachback to make sure that they have patient understanding, I think it's really helpful. So I think it might be worth us just demonstrating that real quick. I guess that sort of means.
I think that's a great idea, Kelly. Sorry about that.
That's okay. So it's just hard. Sometimes it's hard to be real explicit, but I think it helps. So I usually demonstrate it a little bit. So Marcy, we just have just a few minutes left, and I want to summarize and plan our next steps. So as we discussed, I sent the new medication, the Topamax, for your headaches, so you don't run out when you start taking 2 Topamax each morning. And you'll go to the lab next, and I'll send the results when I get them in my chart. If you can send me the symptom diary, in a week we can decide what to do next. Do you have any questions about the plan?
No, that all sounds right to me.
Okay. So I think it's helpful to really signpost that and make it really clear.
Yeah. And I do think, especially with telehealth, you really emphasize that after visit summary even more, because you're not able to just hand it to them. Absolutely. And so making sure that they know they have access to what you've said is a helpful thing.
Exactly.
Okay. Do you have anything else you'd like to add before we take some questions, Kelly?
Not specifically. I don't think so.
Okay. Well, let's see. I think there might be a couple of questions.
Yeah, so I have one right off the bat that I'm going to hit Marcy up with, and the first one is, what do we do about PPE?
Okay, well, so for PPE, what's interesting is many of the things we've already talked about today are just as relevant for PPE, because you can think about the situation where Their interference with people being able to hear and see you, and you being able to hear and see them. Thank you, Kelly. I suppose I could put my mask on
So that was
at the same points. So here are a few things that I would want to emphasize with PPE. Thank you. So let's talk about some of those nonverbals. Will you leave that on a second, Kelly? I think we can have a little bit of fun with this. So a few of the things I would say with PPE is first, make sure that you're smiling, because it can come across, even though you don't think it can, your eyes will squint up a bit. Now, because someone can't see you that well when you're in full PPE, the recommendation is you have some way for them to know what you look like. So the thing we say is, you kind of look like an alien with PPE on. So being able to show them your ID badge, or in some places, I think they might be having even better pictures and saying, this is what I usually look like. I know it's strange that you can't see me, but this is for your safety. And I would keep emphasizing, this is for your safety, but giving them a sense of who you are. So then smiling and using a warm tone of voice, just like when we talked about telehealth, is especially important in this context for those. I think the other thing that is probably one of the most important things for PPE has to do with picking up on patients' emotions, especially if they have PPE on. So if they're wearing a mask, you need to pay much closer attention to what are they expressing as far as their emotions. And they're not going to pick up on your nonverbal empathy, even if your eyes are showing over the PPE, except for leaning in and being attentive and being able to touch them when you're with them. But I think being able to make those much more explicit, empathic statements is really important in this context. I did get another interesting PPE tip when I was talking to someone in orthopedics the other day, who said one of the things they've realized is, especially when doing potentially painful manipulation or procedures that aren't dangerous, when the patient has the mask on, it's hard to pick up on if they're feeling pain or that kind of thing. So if it allows with safety, being able to see under their mask might be a good thing, or just paying attention to that. Anything else you can think of with PPE right now? We have some really good guidelines for that maybe we'll get the Office of Patient Experience to distribute as well.
Sounds fair. Second question that comes up quite frequently is what to do about trying to do my notes and orders and balancing Epic while you're doing telehealth visits. And I think Marcy referred to a lot of this. It's regular time texting. So if you're someone who can type, like I can type while I'm looking at you and looking at the screen, but the patient will hear if you're typing, and they'll know that you're looking around trying to find the order for whatever it is. And so just really clearly say, okay, let me see, it's right here, and being very visible with how you're doing that is helpful. I think you can even say, I'm going to open your note and type while we're talking so that I make sure that we get this. Or I really like, I'm going to type this plan into the after visit summary, which will be sent to you by my side after we hang up. So they can be very clear that you're doing that as you're going along, and it saves time. Any thoughts more about that, Marcy?
No, I think that's really helpful. So
that's then the next question I've got is an interesting one about what to do if I'm seeing a pediatric patient. And this has come up, and there's some kind of fun things that you can do with that. One thing is to think about your rapport and be more explicit in your rapport. So if you happen to be at home, sharing something mildly personal that you can connect with, like a pet, is a really nice thing to do. If you're at your office where you don't have a dog or a cat, or you don't have a dog or a cat, finding something like a book that you can connect with, and using that as a connection is a nice way to do it. If the patient is particularly happy to sit on mom's lap, or older, like an adolescent, they can communicate with you directly. But sometimes this is confusing, and so letting them wander around and then bringing them in when you need to is okay. And even doing something so distracting as, while you're talking, saying, "Oh gosh, can you find the mouse in my picture?" and being specific about something like that, like you would in person, as a distraction, is a good thing for kids. recognizing that they can still talk to you, and in many ways they're often more computer literate than their parents and video literate than their parents, it says that this is actually a good way to communicate with them and they actually like it. Other questions or thoughts? Those are the big things I have. I heard telehealth referred to as instead of our bedside manner. Did you see that, Marcy?
Yeah. Website manner.
Webside manner.
Yes, yes. And Kelly and I are both, we're interested in doing research around this. And so we're actually starting on a collaborative research project with the University of Minnesota looking at, for many of you who supervise learners, you'll be supervising or precepting telehealth visits. So we're starting to look at and try to help develop guidelines for doing that, because it's a bit different than doing in-person supervision. And so if anyone has interest in that, we're pleased to talk to them about that as well. So I think just to close, hopefully everyone's getting used to telehealth visits, or if you haven't done them yet, this provides you a good starting point. I do recommend you look at the telehealth tip sheet that is floating around and available to just help remind you of some of the things to pay attention to in this brave new world that we're in of telehealth. Luckily, telehealth is actually not that new. It's just new to many of us. So there are some really good resources to draw upon in that context. And of course, if you want to reach out to Dr. Skelly or myself to get further information or have us come talk to your colleagues, we're very pleased to do it.
Thanks.
I think that's it. Thanks so much.
Thank you.